Hello, welcome back to my channel. So today I'm going to be talking about electroconvulsive therapy, which is still used in psychiatry today, and it's used typically as a last resort for real chronic, harsh depression. It's also used to treat sometimes mania, acute schizophrenia, and some other psychotic disorders as well. So most people, when they think of electroconvulsive therapy, think of this.
Boy, it's easy. I'll be fine. You? Seated. Ah.
Would you sit up, please?
Sure. Love to.
Oh, boy.
There, might be a little fluid in them boots, you know what I mean, boys? Just a little leak. Light shine, boys, and send the specimen to Nurse Ratchet. You know what I mean? Huh?
All right, out with your gum.
Huh?
Out with your gum.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
A little dab will do you. That right, Mr. Jackson?
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well?
Now just bite down on it. That's right. Just bite down.
Huh?
Now bite down on it.
Are you ready? Here we go.
That's not how it's done anymore. So I'm going to go through a little bit of the history about how ECT used to be done, and I'm going to talk about kind of how it's done now, and try and debunk maybe some of the negative views around it, and try and help people understand why it's still used, especially for those people who have maybe not so positive impressions of the treatment. So pre-1930s, it's been around that long, electroconvulsive therapy was an induced seizure induced using an injection, and sometimes this was using insulin, which, as you can imagine, was very, very dangerous, and it also created lots of fear in people who received it because there was a bit of a delay between having the injection and having the seizure. So you can imagine just kind of sitting there just waiting for a seizure to happen. It's bound to be very, very frightening. So after a while they replaced it with electrodes. So they were in the 40s and 50s. They replaced it with this method with electrodes placed on the head to try and just ease that kind of the frightening aspect of it. So there was no kind of wait anymore. People just got the seizure straight away. So early on this kind of had a significant injury and death rate. As you can see from that video, people had to be held down because they would be violently shaking, and people would break bones, and unfortunately people would die in some instances as well. So luckily it really doesn't happen like that anymore. So people are anaesthetised with muscle relaxants, so they're completely relaxed when they have a seizure. You can hardly see any shaking. It's not a frightening experience at all. And unfortunately, those perceptions that we have of ECT, and it's this harmful kind of treatment, have been somewhat perpetuated by the media and by films like One Flew Over the Cuckoo's Nest, which is interesting because the writer of that, Kersley, in the 1970s, he actually believed in ECT as a treatment. What he was trying to portray in the film is the danger of lobotomies, which is why you see the ending scene, the main character, he has a bandage around his head to depict that he's just had lobotomy, which is a surgery on the brain where part of the brain is removed to try and treat chronic mental illness. So that's what he was trying to portray as kind of this horrible negative thing that we don't need to use anymore. So unfortunately, people perceive that electroconvulsive therapy as the enemy in that film, when really the idea of it was that lobotomy is supposed to be the negative thing. So, you know, there was that, and that kind of perpetuated. It was kind of very much singled out during the anti-psychiatry movement, and electroconvulsive therapy very much became associated with brain damage. So there are some psychologists that say that ECT is comparable to historical psychotherapies that are based upon inducing fear and terror to try and shake out the insanity. Like, for instance, patients in old asylums used to be dunked in ice buckets, used to get water thrown over them. They used to have all these frightening treatments to try and regain their sanity. So kind of ECT has been claimed that it's analogous to that, which is quite, it's a complete exaggeration really. The practice was named deeply disturbing by an editor of The Lancet in 1981, and the APA, the American Psychiatric Association, did a survey in 1978, and they found that nearly half of all US psychiatrists believe that ECT produces slight or subtle brain damage, which is not backed up by the evidence, and the claims that it is frightening experience is not backed up by the subjective experience accounts that we have of modern day electroconvulsive therapy. So the reason why people think that it might cause some kind of brain damage is because often there is a little bit of memory loss after people have the treatment. However, you know, it's kind of analogous to having an operation. You know, there's a little bit of confusion. However, people can regain normality and go back to their normal lives very, very soon after having the treatment. Some researchers actually say that ECT can perpetuate neurogenesis, which is growth of neurons in the brain, so perpetuating brain development, which obviously might help someone who's going through horrific mental illness. So, and also there is research to say that the gaps in memory are very rare, and it is more likely to be that confusion after the treatment. There's also some research to say that there is a phenomenon called BDNF neurotropin in the brain, which occurs after someone's having a prescribed antidepressant. They've also found this with ECT as well, which just goes to show that in terms of our biochemistry, the effects of ECT are very similar to those that you see with modern day antidepressants. Some also, I mean, obviously the biggest issue with ECT nowadays is that there is no theory, there is no clear consensus about how the treatment actually works. There's some theories that the mechanisms that ECT produces are very similar to our brain in a deep sleep, and some researchers believe that being in a deep sleep can be very restorative, particularly for individuals who are having psychotic experiences. If you recall my video on schizophrenia, I talk a lot about how insomnia can be a precursor to psychosis. So that would kind of make sense, but as I say, there's no clear consensus. However, if you look at a lot of our drug history, you'll see that a lot of the drugs that we have today, you know, their positive effects on various different disorders, they weren't expected, so they were very serendipitous. There's a really good article that talks about this, in particular about Kuhn and the imipramine discovery in the 1950s. Obviously, we know imipramine nowadays to be a antihistamine, but back then they were testing it as a sedative within psychiatric hospitals, and they actually found that the majority of patients who took it had this major antidepressant effect, and they weren't expecting that at all. So although ECT gets a bad rep because people say, oh well, there's no clear mechanism as to how it works, how on earth does creating a seizure cause someone to feel better. Well, you can say that, but you can also say that, you know, for a long time there was no clear consensus theory for a lot of the other pharmacological drugs that we have for various mental illnesses. So, you know, really, is it any worse? Some psychologists also say that it could just be the reason why ECT is not used as a primary treatment, it's used as a last resort. And the reason why it gets such a bad rep is because this drugs are so well marketed that ECT just kind of loses out on a lot of that attention, a lot of that research and interest. For instance, if you look at some of the newer drugs that we have out today, such as olanzapine, you can really see the sheer volume of research that's going on. For instance, olanzapine was licensed after 4 trials, and these were split into 234 medical trials that were published, which is quite remarkable. So, you know, it looks like this huge bountiful amount of research, you know, to suggest that this drug is incredibly positive for treating this disorder. But really, when you whittle it down and you see that actually all these studies just originated from 4 different trials, and obviously the trials that weren't effective may not have been published, then it makes you wonder how much kind of these drug trials and this drug research is pushed. And you know, when it comes to ECT, what is the profitable margin on that? How much money can people really make from a treatment that is exactly the same, that can't really change, that we already have all the equipment for, etc. So I guess, you know, that's kind of some of the reasons why it gets such a bad view. And, you know, I guess what I'm trying to do is dispel some of the myths and try and help people think of ECT in a way that isn't analogous to the video we saw at the beginning, in a way that could be a somewhat effective treatment for people who aren't necessarily as responsive to other psychological drugs.